Hi, everyone. I'm Meg Isbitsky, Somerset County Mental Health Administrator, and welcome back to Stigma-Free Stories, our video project where we discuss experiences of stigma as it relates to mental health and substance use with those who live and work in Somerset County. So, the purpose of these stories and our greater Stigma-Free initiative is to spread education and public awareness to reduce negative mental health stereotypes and promote acceptance, cohesion, and community resources. So today I'm here to talk with Anthony Justo, a certified peer recovery specialist working here in Somerset County. So, hi, Anthony. How are you today?
I'm good. Thank you, Meg.
Good. Thanks for coming today. Can you tell us just a little bit of background on your story and how it's brought you to where you are today?
Sure. Yeah, so just like a quick overview. And I always like to start out with talking about before I ever even picked up a drink or a drug, and some of the feelings and emotions that I experienced of like disconnection, loneliness, despair, kind of feeling like a foreigner within my own home. So that disconnection really was unsettling to the point where I picked up my first drink around the age of 12, um, kind of a late bloomer in that respect. And and from there, once I had the beer into me and once the burning stopped in my stomach and the effect kind of took hold, um, I loved it because all of those feelings of separation and disconnection and loneliness kind of melted away, and I felt like I was able to bond with those around me. I felt like part of, and so I thought to myself like I'm going to do this as often as I possibly can,
Mhm.
and so I did, as much as any 12 or 13-year-old can do, um, and the progression took hold, and I went from alcohol to weed, and then from pot, I went to ecstasy, and then I tried cocaine, and so on and so forth, and then the opioid
Mhm.
epidemic kind of really took hold when I was around 18, and that had its grips in me pretty tight. And once I tried opioids, it was off to the races. I was able to I was able to maintain to a certain degree before using opiates. And then once opiates got involved in the picture, there was like nothing was out of bounds. I was willing to do anything to not feel sick and not go into withdrawal. Um, and that's when I started to really experience the more bumpy part of the road, in some of the last days. And for me, that looked like institutions, that looked like jail, that looked like homelessness, that looked like, you can just go down the list and anything that might not have happened yet, like I made sure to check off that box. um, which ultimately led to me getting some pretty serious charges in Morris County for something that I was trying to do to support my habit.
Mhm.
And fortunately, it's a very long story, but I found grace, or grace found me, however you choose to look at it. And I was afforded the drug court program in Morris County after sitting in jail for quite some time, and I found my way into recovery.
Mhm.
So today things are radically different
Mhm.
than they were 10 years ago. My sobriety date is October 9th, 2013. Subsequently, my arrest date was October 8th, 2013. Um, and when I came home and I was on drug court, I was placed in homeless solutions in Morristown. It's on Hanover Avenue. And I think I had like two pairs of clothes.
Mhm.
Um, things were really just not going well. However, I was the happiest I've probably ever been in my life because I was free from the addiction that I had experienced for the previous 10 years. And and so I went through Homeless Solutions, and I rekindled some relationships, and I got into a 12-step organization. I worked for CARES, which is, a part of Prevention is Key in Morris County, as a certified peer recovery specialist. Currently working at Richard Hall in Somerset County. Um, and when I was newly sober, I thought to myself that if there's any chance that I could stay sober and actually turn my life around, I will do anything to help others
Mhm.
to find their way to recovery. And so that's kind of how I found my way to this profession. I like to think. And I got married a couple of years ago, June 28th, 2018. So our anniversary is coming up. My daughter was born December 19th, uh, 2018. We just got back from a trip to South Africa. Um, we bought another house, and like things are radically different than they were, 10 years ago.
Mhm. That's amazing to hear that. So thank you for walking us through your story of kind of some of the dark places, and then also showcasing kind of how you're living now and all these successes that you found. I was going to ask what made you want to enter the human services field, but you kind of answered that already. Um, but just piggybacking off that, do you think that your professional role has had any additional effect on your opinions about stigma?
Sure. Yeah. Um, when I was newly sober, I thought that there was one way to recover.
Mhm.
And so like for me, there is one way to recover, right? That's still true for me on a personal level. But as I've gotten into this professional role of helping others to find recovery, I've learned that there's no monopoly on recovery, and like medically assisted treatment, and alternative routes to recovery um, do exist, and they work.
Mhm.
That's definitely something that I was not aware of. I was unsure how that would look or how it even be possible, because I was only going off of my experience. So that's a stigma that's definitely um, been reduced. Um, and even still, I talk to some guys that are in my personal circle, and they're like, "Oh, look at so and so, like he came off of the booze, but now he's smoking pot to maintain, like he's not sober." And I'm like, well, you can't really say that. Like what constitutes recovery, right? It should be self-defined as far as I'm concerned. And that's something that I had to learn, and it was a stigma that I had coming into this that's no longer there.
Mhm. I think you touched upon a really important point, that even if we're in the field as professionals or human services workers, that we just assume that we have this level of comprehension that doesn't include stigma, but we all have a piece of it that we do have to learn. So I'm glad that that had a positive effect on you. Can I ask what surprises you the most about your own recovery journey and where you are today?
um, what surprises me the most is just, I guess, the paradoxes that I've found in recovery, right?
Mhm.
Like the more that I think about others, the better my life gets.
Mhm.
Like the less I think about myself, the better my life gets. And the more that I'm willing to extend myself on the behalf of others in a loving manner, the more I learn how to love myself.
Mhm.
So like I wasn't expecting any of this when I came in, when I was new. If you would have told me that like going and helping some guy, who's half drunk get into detox will keep me sober, I would have been like, well, two and two is four, but this isn't adding up.
Mhm.
Um, but it's definitely been my experience, to tie back to what you were saying, like how we come in, possibly come into this, or at least I did, and have some stigma that I was not really even aware of.
Mhm.
Um, One thing that was taught to me throughout this process is, that the most evolved people, the most important thing that we can ever know is that we don't know, and just totally remain open minded, And that's probably been like the most helpful, both professionally and personally. You know?
Yeah, absolutely. And also operating off of going off your point, operating off that notion that we always can learn more, and that, this isn't just a stagnant experience that everybody has the same notion of. Like you said, there's not just one way to treatment, and or there was for you, but it's not the same exact for everybody. Everybody didn't have the same experience or opinions, and so we have to all understand, like, this is bigger than just one experience. It's a whole community, and we all have very, very diverse stories when it comes to our relationships with mental health and addiction. What is something that you wish the greater community knew about mental health and substance use disorders?
Yeah, when I'm out and about in the community and I'm trying to like really advocate for recovery, I guess the most important thing, and again, this is just my opinion,
Mhm.
but there is some clinical research that does back this, um, is how we look at drug addicts and kind of like shun them
Mhm.
or banish them from society,
Mhm.
um, is the worst possible thing that we could do,
Mhm.
right? Because like a lot of folks think like, well, he or she's been bad, like got to show him tough love, can't let him around here, can't talk to him, can't show him any affection. And so to a certain degree I understand why one may have to do that for their own well-being. And I totally acknowledge that and respect that, but when speaking to the greater community, I think that it's important to remember that a lot of folks,
Mhm.
thousands that I've spoken to that are just like me, report feeling the way that I did before they picked up a drink or a drug. And so that feeling of disconnect, of loneliness, of isolation, if that's something that exists before the drink or the drug and makes the drink or the drug so appealing, then when somebody's trying to get well and you're pushing them aside and cutting them off, I mean, the natural next step would to be go back to the drink or the drug, right? So I wish that we would understand that a little bit more. That community is probably one of the most important things that can help somebody in their recovery.
Mhm. I absolutely agree with that. And even to that point, then you're not really assisting somebody in learning how to get over that isolation or creating that connection and those positive skills so that they don't go back to whatever drug of choice or alcohol, because they are able to find those needs and get those needs met in other healthier ways. I absolutely agree.
Well, that's why it's like, it's so nice to see some of like these programs that are being implemented over the last, I don't know, however many years. Like I really took notice when Governor Christie was in and he was making a lot of headway and putting a lot of rehabilitation programs in the state. Because like you look at the recidivism rates,
Mhm.
right? And like a lot of drug users end up in prison and like they're further isolated during their prison stay. They come home, they can't get a job, they're not welcome back into the community because of their background. And it's like, well, what else would you do other than use at that point? So it's really nice to see that these things are kind of being acknowledged, and change is starting to take hold. So yeah.
I agree. I think it is nice to see, even from, I think you said 10 years ago. I mean, the fact that we can have all these programs, have all these conversations, and be able to spotlight, use all these platforms to talk about, recovery and treatment and prevention. I think that's an amazing thing. I mean, in my opinion, we still have a lot to do, but it is really nice to see our community taking a piece of this and wanting to be more educated and open-minded and cohesive. So that's why it's so important that you're here today talking about it. But anything else that you want the listeners at home to pick up on while you're here?
Um, I guess that the idea that like people treat this as a taboo topic, like, and I can only speak for myself, but like, don't be afraid to ask.
Mhm.
You know what I mean? Like, approach me, approach whoever it is concerned and be like, hey, like, what's going on? Like, how do you feel? Like, how
Mhm.
can I help? What would make things better for you, or like, what's bothering you? Like, just start a conversation, and like, let's remove the stigma as a whole, and not make it so taboo to be vulnerable with people.
I absolutely agree with that. And then to just spread more awareness and education, get rid of some of these negative stereotypes that are untrue and hurtful, and instead take on as a community, we're all responsible for having a safe community for us all to live in. And so I always really like the phrase like know better, do better. So if we do know better, then we shouldn't be kind of caught up in some of these taboos and putting power into these stigmas that just further isolate and ostracize people. So I absolutely agree with that. Thank you again for joining us today, Anthony. And thanks to all of you watching at home for Stigma Free Stories, and stay tuned for what we will do next. Thank you.